My name is Laura Gomez-Pathak, and I am a social welfare PhD student here at UC Berkeley. Today, I'm here to talk about a study I'm currently conducting, sponsored by the CLTC. The study is about understanding vulnerable patients' perspectives on data privacy and security as it pertains to their use of mHealth applications and sharing health information. We know that mobile health or mHealth apps have a potential of decreasing disparities in health. However, they also present unprecedented data security and privacy challenges, which is especially crucial when thinking about mHealth applications that are targeted to vulnerable populations, since we know that users with marginalized backgrounds have a greater risk of experiencing the more detrimental consequences of any privacy and security breaches to the very private health information that they may share with apps and with providers. However, while we know that there is an obvious need for data security and privacy protocols and standards in order to build more reliable and secure apps for vulnerable users so that they can fully benefit from accessible and personalized interventions for their health and mental health, when looking at the evidence base on this topic is very limited. When looking at research on the privacy and security knowledge, attitudes, and apprehensions of users from low income and ethnic minority backgrounds, it's especially limited, which motivated me to conduct this exploratory research study to try to understand vulnerable patients' knowledge and attitudes towards these topics, especially around location tracking by smartphone apps, attitudes towards data security and privacy, and their understandings about the risks and benefits of using digital health self-management interventions. So this is a small qualitative study consisting of individual semi-structured interviews with 25 patients who are part of a large safety net healthcare system in the San Francisco Bay Area. The interviews were conducted via Zoom or phone call, according to participants' preference. And while we are almost done with data collection, we haven't started with systematic data analysis as of yet, but we have seen some things emerge from the data that we have collected so far. And I want to present a couple of very preliminary findings with you all today. That revolve around some themes. Theme number one is that there seems to be a correlation between tech literacy levels and the amount of privacy concerns that patients have. Take, for instance, someone like John. He's very tech savvy and uses electronic health records, is a very high user of technology. When asked about if he has any concerns about the privacy of his health information when communicating with providers, he seems to be very unconcerned. And that's the case throughout, and also in the other way around, where we see that when interviewing patients who are less tech savvy or have less tech literacy, they seem to have more privacy concerns when sharing their health information. Another thing that has emerged is around data security, specifically when it comes to patients who have experienced data security breaches in the past, like their identity theft victims. And take the case of Martha, who, although is very tech savvy as well, she is particularly concerned about using technology for health and medical purposes. And when asked when we probed her more about this concern, she says that because of her past trauma around this incident of identity theft, she's very, very cautious and she wants to protect her identity. And she just overall feels like technology has made the world more unsafe for people like her. And even though she does use technology for a lot of purposes. Another thing that has emerged is around location data tracking. It seems to be very contextual depending on the person. And some people think it can actually lead to profiling. Someone like Mario, here we have a quote where he feels like it could easily translate into being profiled. But yeah, this is just preliminary. And I would like to acknowledge my team. Without them, this couldn't have been possible. And thank you so much.